this live session today, I'm talking about a chemical pregnancy. Mu live session yaffe eno eya leero ndikwogera ku kyetuyise a chemical pregnancy. You could be asking yourself, what is a chemical pregnancy? A chemical pregnancy is when a woman gets pregnant, but the pregnancy does not proceed to 9 months. The lady gets pregnant, but the pregnancy does not proceed to 9 months. There are many reasons as to why a woman could end up with a chemical pregnancy. This could actually be due to issues in a woman's womb. They could actually be due to issues on the woman's eggs, basically the egg that was fertilized or her follicles that were fertilized. Maybe if they were of poor quality, then there's an increased risk of a woman getting a chemical pregnancy. Omukyala wabanga badde alinamuko ku buzibu n'amagige, and then all of a sudden nabanga yafunye olubuto ate nga amagige gabadde tegakola bulungi, amagige gali of poor quality, omutindo gw'amagige nga si mulungi, omukyala oyo asobola okufuna kye tuyise a chemical pregnancy. The other reason as to why a woman could end up with a chemical pregnancy could be due to the fact that maybe it could be an issue on the man's side. The man could actually be having issues with his sperm count, with his sperm motility, with his sperm morphology. We call this the appearance of the sperms. So if the husband has issues with their sperm counts, even though fertilization takes place, there could actually be an increased risk of a woman getting a chemical pregnancy. So ekirala kisobola okubanga kireeta embeera eno okubanga omukyala asobola okufuna kye tuyise a chemical pregnancy, kiyinza okubanga kiva ku side ey'omusajja. Omusajja ayinza okubanga alina obuzibu n'enkwaso ze nga maybe nnafu nga tezimala bulungi, oba nga zirina structure oba appearance oba engeri gye zirabikamu nga teri within the normal ranges. N'ekirala oyinza okusanga nga maybe omusajja alina obuzibu ne kye tuyise the chromosomes. We call these chromosomal abnormalities. So chemical pregnancy is our main topic for today. I'm talking about a chemical pregnancy. If you have questions about chemical pregnancy, you are trying to get pregnant but things are not working out, you are asking yourself what could be happening, then it could actually mean that there's something that is not right. Hi Frogs MM, how are you doing today? Hope you are fine. I'm talking about chemical pregnancies. I'm called Gerald Massa and I'm a fertility coach. Remember, you can ask your questions. I'll be able to reply to all your questions. So chemical pregnancy is our main topic for today. Yes, okay, you've replied. So how are you doing today? Could you be having any questions about fertility, about a chemical pregnancy? You can ask in the comments. I'll be able to reply. So as I was saying, specifically, chemical pregnancies are so common nowadays, and the main reasons as to why a woman ends up with a chemical pregnancy, it could actually be due to issues that are happening in the woman's womb. It could actually be due to issues that are happening on the man's side. If the man has issues with his sperm count, if the husband has issues with his sperm appearance, we call this the morphology. Matt Ifan Olo Teo, how are you doing today? You are most welcome to today's live session. I'm called Gerald Massa and I'm a fertility coach. In this live session today, I'm talking about chemical pregnancies. So going on, how can a woman know that this could be a chemical pregnancy? First of all, we know that chemical pregnancies are pregnancies that do not go beyond 20 weeks. They are pregnancies that do not cross 3 months. If a woman gets a pregnancy and within 1 week, within 2 weeks, the pregnancy is out, within 4 weeks or even 6 weeks, the pregnancy is out, normally this could be what we call a chemical pregnancy. But remember, it belongs to what we call a miscarriage. Any pregnancy that does not go beyond 3 months, it is actually a miscarriage. But in this particular video, in this particular session, I'm talking about a chemical pregnancy. Matt Ifan, you are most welcome. Thanks for joining today's live session. And remember, you can ask all your questions. I'll be able to reply. Matt Ifan, you are most welcome. So, talking about chemical pregnancies, how can a woman know that she has just had a chemical pregnancy? When she goes to a hospital and she talks to her doctor about what is happening, normally the first sign of a chemical pregnancy is that bleeding from the private parts, but still the doctor will go ahead and do some tests on this particular lady, and the first test or investigation that could be done is what we call the pelvic ultrasound scan. And then the doctor could go ahead and also do what we call a serum HCG pregnancy test. In some scenarios or in some places where the serum HCG pregnancy test is not available, then the doctor could go ahead and do the urine HCG pregnancy test. Normally, the urine HCG pregnancy test, the serum HCG pregnancy test is going to be positive. It's going to confirm that pregnancy is there. Why? Because of the hormone known as the human chorionic gonadotropin hormone, the HCG hormone, because it is still present in her system, because it is still present in her bloodstream, in her urine, the pregnancy test is going to be positive. When she goes ahead and the doctor does what we call the pelvic ultrasound scan, then the ultrasound scan will show that the inside of the womb is actually shedding. The inside of the womb is filled up with contents. We call these echogenic contents. These could actually be the remains of what was supposed to be a pregnancy. The doctor who has done the scan will most likely conclude that he or she is seeing what we call retained products of conception. Normally they are kind of a bit whitish. On scan, in scan language, we call these heterogeneous contents. Okay, they are mixed up with what was supposed to be a pregnancy, and normally the doctor could go ahead and maybe do an evacuation. We call this cleaning of the womb in the hospital. So chemical pregnancies are so common nowadays, and if you are asking yourself, how can a couple reduce the incidence of getting a chemical pregnancy? How can you reduce the risk of your wife getting a chemical pregnancy? How can you as a woman reduce the risk of a chemical pregnancy happening? This is what I'm now discussing about. There's what we call preconception care. Preconception care. Before you go ahead and get pregnant, if you are planning for a pregnancy, it's always very advisable that you go to a hospital for a proper screening by your doctor, for a proper assessment, for a proper checkup by your doctor, so that tests can be done to really confirm whether the husband has some deficiencies or has some issues that could predispose you to a chemical pregnancy. It's also very advisable for you as a woman to also go for this support, preconception support, so that tests can be done on you to really confirm whether you are at risk of getting a chemical pregnancy. Okay, so specifically, chemical pregnancies, preconception support to prevent chemical pregnancies, the first step or the first test that could actually be done on a woman who is planning to get pregnant, the first test that could be done is actually what we call the AMH test, the anti-Mullerian hormonal test, AMH test. This test looks at the quality of the woman's eggs. It also looks at the reserves of the woman, the egg reserves. It also looks at how soon this particular lady's eggs are actually ready to be fertilized. The quality of the woman's eggs can be assessed by using or by doing the AMH test, anti-Mullerian hormonal test. If the normal is supposed to be 1 up to 4 Ng per milliliter per deciliter, and then the results show that you are actually in maybe 0.4, 0.5, then it actually means that much as fertilization can take place, okay? Remember, these ranges are actually different depending on your age, okay, as a woman. So if you do the AMH test and it shows that your levels are actually reduced or they are reducing, then your doctor could recommend therapy. Your doctor could recommend treatments to boost your AMH test. Your doctor could actually go ahead and recommend what we call the diet modification. Your doctor will go ahead and advise you on what you're supposed to eat and what you're not supposed to eat. There are other therapies or there are other treatments that could actually be provided by your doctor depending on your AMH results. If you undergo these tests, then the risks of having a chemical pregnancy could be reduced. If at all the womb, the inside of your uterus has issues, then the ultrasound scan can be done to confirm this. And if the ultrasound scan has been performed and it shows that the inside of your womb, that layer where the baby attaches, that layer where the baby implants, we call this the endometrial lining. If the ultrasound scan shows that the inside of your womb is actually shedding, maybe the endometrium is very thin, then still your doctor will advise you on the best treatment you are supposed to actually begin on. Okay? Let me check if there are some questions. Otherwise, I welcome you all my viewers who are actually attending this live session. I'm really so happy that you are here. Okay. Okay then, so today's live session was about a chemical pregnancy. Yes, today's live session was about a chemical pregnancy, and let me know if you are having any questions. I'll be able to reply. Thanks a lot for attending today's live session, and I'm so happy that you were here with me. We talked about a chemical pregnancy. You can still tune in tomorrow for another session about fertility. If you are having questions about fertility, tomorrow I'll be online. I'll be able to answer all your questions. Remember, I've been talking about a chemical pregnancy, and I was saying that a chemical pregnancy is when a pregnancy fails to go beyond 6 weeks. It's when a pregnancy fails to go beyond 6 weeks. And normally, reasons as to why chemical pregnancies do happen, it could actually be due to issues on the man's side, or it could be due to issues on the woman's side. These issues on the man's side could actually include sperms of poor quality, sperms of poor morphology, poor appearance. They could also be due to issues on the woman's side. This could actually include poor egg quality, among other reasons. So thanks a lot, all our friends who tuned in today for today's live session. I'm so happy. Let me see you tomorrow at the same time, 3 p.m. East African time, and then we shall be able to go on with our daily fertility sessions here on YouTube. Thanks a lot, and have yourself a blessed day. God bless, and bye-bye.